The Health Foundation report that you're referencing, which is where my comments kind of come from, actually does show that since the 2004 contract, there hasn't been any uplift above inflation over the last 20 years for GP partners. So whilst there are a minority of GPs on high levels of earnings, the majority of GPs are not on those high levels of earnings. They're on much more modest amounts. And the reality is that we need to reflect that back to the government, that actually any additional money that has been put in over the last 20 years hasn't resulted in GPs earning more. GP partners' income has actually remained very stable. If you think about the way GPs are funded, that makes complete sense. So I think it's by putting in contractual levers and making sure that the funding does go to employing more staff, employing more GPs, but there's lots of ways we can do that, and we just really urge the government to talk to us about it, because we are happy to work with them to find a way that ensures we can have more GPs. Most GPs aren't after increased earnings. Most GPs are after a better working life, after an ability to care for their patients more effectively. They're after the ability to not be faced with 150 online consultations all in one go and with no additional resource to manage those.